recording. Lasit, as the treating oncologist, would you give the treatment?
I think there are a lot of things to consider here first. First of all, you got to consider that the treatment hasn't been studied well and the efficacy of the treatment is very uncertain. And there are side effects involved in the treatment, causing clear discomfort for the girl, severe nausea and headaches. And then we don't know the extent of the cancer in the 5-year-old girl either. We don't know whether it's stage 1, stage 2, 3, or 4. Can it be treated with other treatments? We need those answers. So what is the cancer, first of all? Where is the cancer? We need to locate it, find it, and then this need to know what other kind of treatments are there available. Can it be removed surgically? Is chemotherapy available? Other things like that. And they need to be discussed as well. Now, in terms of the treatment, as the efficacy is unknown and the cost is very high, this needs to be discussed with the parents of the 5-year-old girl. The 5-year-old girl is unable to make decisions themselves. Such a difficult life decision is, even though autonomy is valued, autonomy is limited here. And essentially, the parents are inclined to make the decision on behalf of the 5-year-old girl. Of course, all of them will be informed about the decision at once. But the parents will be inclined to make it. So I think as an oncologist, I would consider whether the families available can actually pay for the treatment themselves. Are they willing to go ahead with the treatment, or are they willing to try out other treatments? I think we need to weigh out those options. And if the family is willing to try out other treatments that have more studies to back them, even though they might have other side effects, I think it's better to go with that. You need to consider what the family thinks. Now, personally, you can't actually think of this personally, but I wouldn't recommend the treatment because the efficacy is unknown and the cost is very high, and it will cause clear discomfort for the girl, and it's not even sure what the treatment will do. So is the treatment going to actually stop the cancer, or is it going to stop part of it? Is it going to leave part of it and then become worse? So it's not sure what kind of investment is being made here into the treatment. And we need to get to the bottom of that. So to summarize, we need to find out, I need to find out as an oncologist, what's the extent of the cancer in the girl? Are there any other treatments available? Discuss them with the family, explain them the costs of investing in a treatment that there are no studies to back it up really of the efficacy of the treatment, the side effects, the pain and discomfort it might cause for the girl as well.
Very good answer. Second question, just say the patient's parents want you to make the decision. What would you decide?
So as I highlighted before, the patient's parents are inclined to make the decision on behalf of their 5-year-old girl, as the autonomy of the girl is limited here, as they are unable to make such difficult life decisions due to their young age at the moment. So what I would decide is, yes, in the end, I'm inclined to make the decision for them, but I also need to consider, are they forcing it on the girl? Are there ethical issues at play here? Are they really making the decision for the benefit of the child, or is it going to be bad for the child? So I think, first of all, if I think it's going to be bad for the child based on what I know about the treatment and what side effects there are, as opposed to other treatments available, I think it's important I clearly discuss them with the parents first, and I inform them of everything available to treat the cancer before actually going ahead and deciding to giving them the treatment. So I think once informing the parents, they are able to make a clear decision with more clarity, so that it's benefiting the child in the most beneficial way. So essentially, I'm upholding the principle of beneficence. The most beneficial treatment for the patient is being given here, rather than limiting my options by not informing them of all the treatments available. So I would decide based on whether it's causing harm to the girl, as per the principle of non-maleficence, not to cause harm. if it's causing harm to the girl, I think significant harm to the girl. If there's any other issues going on, such as family issues, then you can, or like you notice signs of some abuse or something like that. That's also important to consider if they're being too authoritative with the girl. And if that is the case, then referring to someone else, like the higher authority, would be something you'd do.
Hmm. Hmm.
But I think I'd weigh up all those options before deciding to
Hmm.
go ahead with the treatment. And based on what I told them, based on what they gave me, I think I can go ahead with the decision if they believe it's right, and if we all agree
Hmm.
as well.
Hmm. Okay, so you're not conclusive here, is it? Because what?
I would decide based on the patient's parents' decision and my information given. It can vary from context to context, as I explained.
Okay, okay, we'll discuss when we come to the discussion. Third one, you. Okay, so I wanted to clarify, were you given the treatment in the previous question or not? That treatment, or do you give
Um,
other treatment?
so yeah, there were two sides to it. That if I believe it's right, and if I don't notice signs of, say, abuse or something to the child, and if I believe it's in the child's best interests, among the parents' best interests, then I would give the treatment. If not, I won't give the treatment.
Okay, so you gave the treatment and your patient dies. How do you feel? Do you feel that you made the right decision?
Well, yeah, the patient dies. It's uncertain if they immediately die or if this is 5 years later, following stage a serious extensiveness of the cancer. Um, so if it's regardless of if it's initial or later, I think it's important to consider that I'll be feeling very upset about this. Like I'd be feeling like I might feel like I didn't make the right decision initially because of my emotional thoughts clouding my thinking process at the moment, and I might feel that I could have done better to revive the girl, or maybe provided another treatment that might have helped prolong the girl's life initially. But I think once I've considered the options and I've weighed out whether other treatments will prolong the girl's life or whether this treatment was the best option, if
Yeah.
I thought this treatment was the best option based on discussing it with the parents,
Mhm.
and we come to a decision, and I believe it's the right one and they believe it's the right one, and there's nothing bad about the treatment, then I think I would feel essentially later on, after my emotional thoughts aren't clouding the way, I would feel like I did make the right decision,
Yeah.
and this was in the best interest of the girl.
Mm.
And I think essentially to come to that decision, I've considered a lot of things.
Mm.
Like obviously, I've considered other treatments. I've consulted the patient's parents,
Very good. Your
and
time
it would
is
be
over.
very
Yeah, go on. Your time is over. Complete it. That's okay. I'll give you a few
yeah.
seconds.
That's it. I think I would feel the right decision if I believe I informed. I discussed all the other options with them.
Yeah, very good. Very good. Yeah, that's good. Okay, I'll stop recording.